that. Okay, perfect. Okay, lovely. So great. I think we're good to go. Okay, so today I'm really delighted to welcome Dr. Catherine Houghton, who's a senior lecturer in the School of Nursing and Midwifery in NUI Galway, and Megan McCarthy, who's a research support officer in UCC. When she was working on this project, she was a research assistant in NUIG. So this project has been led out of QUESTS, which is the Qualitative Research and Trials Centre, and Dr. Houghton is the co-chair of that organisation. Yeah, really delighted to have them presenting on the QUALShare project, which is looking at qualitative data sharing in clinical trials. And just want to kind of, I suppose, mention just a couple of housekeeping bits and pieces. So as I mentioned, the talk is being recorded and we'll post it on YouTube afterwards. And also we'll do a Q&A session at the end. So if you have questions, you can type them into the chat and we'll pick them up at the end, or you can unmute yourself and just ask your question at the end. And the other thing just wanted to say was just a few words about the Open Science Society itself. So basically this is the aims of the EHPS Open Science Special Interest Group. So our aims are to bring together health psychologists interested in open science behaviours, to share best practices and innovations in open science to health psychologists and behavioural scientists, to provide guidance and or training on open science, to promote the role of health psychology for improving open science across disciplines, and to liaise with organisations which promote open science, and as well as this to encourage and reward replication and reproducibility within health psychology. So we recently had our first ever EHPS Open Science SIG bursary for early career researchers. So please do watch for that every year. So that's open to EHPS members. So this is our committee. So the Open Science Special Interest Group is chaired by myself. So I'm Dr. Elaine Toomey from the University of Limerick in Ireland, and co-chaired the group with Dr. Emma Norris from Brunel University in the UK. And we have lots of different members on our committee from different countries across Europe. And we also have an advisory group made up of more senior researchers in the area. Okay. So I'm going to hand over to Megan and Catherine. And yeah, I'm going to mute myself, and guys, if you have any questions or things you want me to do, just let me know. Thanks very much.
Thanks very much, Elaine, and thanks everyone for coming today. So I'll just start with a quick introduction. So as Elaine mentioned, I'm working as a research support officer in UCC at the moment. And previous to this role, I had the great opportunity to work as a research assistant in Galway on this QUALShare project. So today we'll just discuss, I suppose, some of the challenges and the opportunities that we learned from the QUALShare project. So this project was funded by the Health Research Board Trials Methodology Research Network in partnership with the MRC NIHR Trials Methodology Research Partnership. So I suppose for those of you who mightn't be aware, I suppose the HRB TMRN, I suppose it's a relatively new collaborative initiative between the higher education institutions in Ireland and methodology centres. So Dr. Catherine Houghton, who is the lead PI on this project and received the funding, will just say a few words now just before we begin.
Hi everybody, my name is Catherine Houghton and I'm a senior lecturer in the School of Nursing and Midwifery. My methodological background is primarily qualitative research and more recently qualitative evidence synthesis. And myself and my co-chair, Dr. Andrew Hunter, set up QUESTS, which is the Qualitative Research and Trials Centre under the umbrella of the HRB TMRN. Sorry, there's lots of acronyms here. More recently, I've joined the qualitative, or I'm co-leading the Qualitative Research and Trials group within the TMRP, the Trials Methodology Research Partnership, which kind of spans across the UK and Ireland. So this funding opportunity came up last year, and it was something that was kind of niggling me a little bit. I won't lie. You know, very interested in the concepts of open science, very interested in the concepts of data sharing and open data and the potential benefits of that, but slightly kind of just concerned or just wanted to learn more about qualitative data sharing. And this also came from some work with with Elaine Toomey that I had done earlier about 2 years ago, maybe, Elaine, where we looked at early career researchers' experiences and thoughts around open science and open data. So I put in for this funding, very lucky to get it, and even luckier to have the chance to work with Megan McCarthy on this project. So Megan is going to kind of give an overview of what we did and why we did it, and I'll present the findings then afterwards.
Thanks very much, Catherine. So just before we begin as well, I'd just like to acknowledge all the members of our research team without going through all the names now here, but I suppose the team was established through the TMRN and the TMRP with researchers who share common interest in data sharing and who have experience in this area. So just to start on a bit of background about data sharing. So I suppose there's multiple different ways of, coding data. So I suppose, for example, you can focus on relationships, emotions, and much more. So I suppose this enables researchers to conduct novel research with previously collected data sets. So I suppose as a result, this maximizes scientific findings, cost effectiveness, and reduces research waste. So I suppose a lot of you would be aware that qualitative research, including focus groups, for example, there's huge, financial implications involved in recruiting participants, conducting the focus groups, and analysing the transcripts. So I suppose reanalyzing data for different or multiple purposes, saves these financial costs. So I suppose the value then of data sharing is well recognised, and a moderated or controlled access approach is recommended, and there are guidelines which exist for how this should be done. So while substantial challenges are there to data sharing, I suppose there are additional challenges for qualitative data sharing. So this is particularly, I suppose, in the context of GDPR and its implementation in the Data Protection Act, where an individual's right, I suppose, to the data is really important. So I suppose, therefore, I suppose pseudonymization has been identified, as a major barrier to data sharing. So I suppose qualitative research, such as, focus groups and interviews, which I mentioned already, they're much more identifiable than quantitative data. So while the public, they may assume or they might expect their quantitative data to be shared, they may not be as clear or as comfortable with sharing their qualitative data. So I'm just going to move on now to, the values of qualitative components of trials. So the first one there is for developing further research hypotheses and instruments as well. It's very valuable for gathering complementary information to contribute to answering research questions. And another common one is for explaining findings in depth. So I suppose qualitative methods can be used at all stages of trial by development or reporting, but are particularly helpful in developing and evaluating complex interventions by exploring the potential issues experienced by participants. So also as well, qualitative components in trials are valuable for addressing recruitment and retention issues, which may not be easily addressed by quantitative methods. So I suppose qualitative research can provide guidance to researchers on how best to recruit participants to their trials, which is, I suppose, a persistent challenge for clinical trialists in particular. Qualitative components of trials are valuable for ensuring trial designs are appropriate to both the population and the condition that they're addressing, and also for assessing whether trial processes are important. So I suppose in trials that do include qualitative components, I suppose their data collection and analysis and sampling strategies are often unclear or not even described. So I suppose qualitative research and analysis can have huge benefits in the design, conduct, and reporting of trials. And I suppose they all contribute to the development of the future, I suppose, development of multi-method trials. So now just moving on to some of the challenges around qualitative data sharing in trials. So I suppose one of the major ones is there is little guidance on how to approach sharing this type of data. So I suppose while guidance from the UK Economic and Social Research Council applies to sharing data, qualitative data generally, I suppose it doesn't incorporate the additional information needed, including needing to incorporate consent into already complex recruitment processes. And then you also have the additional sensitive nature of health related data. So I suppose as a result, investigators lack proper guidance on how to comply with data sharing guidelines in a way that, you know, protects their participants. So there's also, I suppose, the concern that by anonymizing the data that you'd lose some of the research value, particularly the context, which will be another challenge. And finally, as well, I suppose, another challenge of qualitative data sharing trials would be that participants' identity can be difficult to conceal. And not, I suppose, just the participants' identity, I suppose research locations may be potentially identifiable as well, which I suppose would be particularly in larger multi-site studies, which would be more concerning than smaller studies. So now just moving on to the overall aim, I suppose, of our project, which was to explore whether and how trials teams share qualitative data collected as part of the design, conduct and delivery of trials. So this is one of our key objectives as well. So another one of our key objectives was to perform a content analysis of current consent procedures for sharing qualitative data collected as part of design conduct or the delivery of trials. So I suppose we'll discuss this later as well, but this involved looking at, you know, participant information leaflets and consent forms that included qualitative data components in trials. And finally, as well, I suppose the last key objective of ours was to initiate and to foster relationships with key stakeholders such as the HRA, the UKCRC, Irish clinical research facilities such as CRF in Cork and Galway. And I suppose this was to ensure that future work on qualitative data sharing is collaborative. So I suppose this project, the aim was to provide a foundation for future methodological work and I suppose production of guidance in a way by exploring the potential issues and experiences of those who want to share qualitative data in trials. So I suppose our first initial steps was the publication of our study protocol, which was in HRB Open Research. So for those of you who mightn't be familiar with HRB Open, I suppose it's a platform for HRB funded researchers so that they can publish their research outputs in an open and an accessible way. So this was subsequently peer reviewed and passed, and I suppose we also registered our study protocol with Open Science Framework. So this is an open and, you know, an accessible platform for everyone, which encourages collaboration among researchers. So the extended data to our protocol, which included the recruitment emails, participant information leaflets, consent form, the distress protocol, and the interview topic guide. So we deposited those in Open Science Framework. And I suppose one of the advantages as well of the fact that we publish in HRB Open Research was allowed immediate publication. So we were able to get our protocol out there without any delay. So just moving on now to the methods. So we had two separate work packages. So the first work package involved focus groups with members of the following stakeholder groups. So this included trial managers or clinical trialists, qualitative researchers, members of research funding bodies, and trial participants who have been involved in qualitative research. And a second work package then was a content analysis of the current consent procedures for qualitative data collected as part of the conduct of clinical trials. So we will discuss, I suppose, the second work package later on. But just discussing now, I suppose, the first work package, which is focus groups. So we used a maximum variation approach to sampling to capture the views and experiences of stakeholder groups in the UK and Ireland. So in terms of sampling, I suppose we aimed for data adequacy, whereby we aim to have, sufficient data for meaningful analysis. So I suppose in the context of our study, data adequacy would have been more appropriate than data saturation, as it's often, I suppose, poorly defined in qualitative research. So we conducted separate focus groups with members of trial managers, clinical trialists, qualitative researchers, members of research funding bodies, and trial participants who are involved in qualitative research and trials. So in terms of recruiting participants, we designed, with the help of Sandra Galvin from the HRB TMRN, we designed 3 flyers aimed at each of the stakeholder groups. So the flyer that you'll see there on the left is one that was for qualitative researchers and clinical trialists. So in terms of recruiting participants, we contacted the UKCRC, the Irish Clinical Research Facilities. So this included CRF in Cork, Galway, and St. James Hospital in Dublin. We contacted the TRMN, the TMRP, and QUEST as well, which is Qualitative Research in Trial Centre. So I suppose the main aim of QUEST, I suppose, is to maximise or to recognise the value of qualitative research in trials. So we asked them to circulate the flyers through their social media channels or their mailing lists. So I'll just quickly as well run through our inclusion/exclusion criteria. So participants had to be 18 or over and had to be a member of one of the stakeholder groups. I suppose we excluded anyone who's under the age of 18, who had an impaired capacity to consent, or who were unable to understand or speak English. So we also excluded those who were currently in a clinical trial. I suppose for 2 reasons. We didn't want to overburden them, and we wanted to be able to fully reflect on the experiences of those involved in trials. So in total, we conducted 3 focus groups and 2 individual interviews. We gave participants the options of individual interviews to give people, I suppose, that flexibility. So in total, we conduct focus groups with 9 qualitative researchers, 3 clinical trialists, 3 trial funders, and 1 trial participant. So due to current, COVID-19, we conducted those virtually using Zoom, and we audio recorded them. We opted to go for semi-structured focus groups. I suppose this allowed, the researchers to remain flexible, and additional probes were used, I suppose, to explore certain areas in more depth when applicable. So the interview topic guides were developed by some of the members of the research team who would have experience in this area by reviewing, existing literature on data sharing. So we explored, I suppose, the perspectives of sharing qualitative data, some of the potential benefits and the challenges, and recommendations for what guidance is needed. So we manage the data within QSR in vivo to enhance transparency, and we analyze the focus groups or the data from the focus group using thematic analysis, which is, I suppose, an inductive approach to analysis, going beyond interpretation into kind of description. So I suppose we did this, without going into the steps, we did this in line with the key 6 steps outlined by Braun and Clark. So I will just hand over now to Catherine to discuss some of the key findings or the key themes from our findings. So thanks, Catherine.
Thank you, Megan, and thanks for explaining the method so well. So after our thematic analysis, we came up with 3 key themes, and understandably, and particularly with a focus on the fact that we had recruited more qualitative researchers in trials than the other stakeholder groups, as you can imagine, there was a lot of concerns about qualitative data sharing. The understanding and experiences varied, and there was generally more knowledge around the practice than the experience of actual qualitative data sharing. And then the third theme looks at future guidance and funding, so how the people in our focus groups felt that they could be better supported going forward in terms of qualitative data sharing. Next slide, please, Megan. So firstly, just to look at the understanding and experiences, and as I said, these perceptions were more based on a knowledge of qualitative data sharing rather than specific experiences of data sharing. And people could see its value. So firstly, the reusing of data for future research purposes. However, they had very limited experience of qualitative data sharing in itself. They were more used to the particulars around quantitative data sharing. So again, they could see the potential benefits through analysing the qualitative data in new ways and making the most of available data to answer new questions and reduce research waste. And the participants did say that you know, they realised the time, the effort, and the participant burden themselves, you know, asking people to take the time to do a qualitative interview. This was an opportunity to make the most of that data. So just the quotes really in terms of some of that, I have a lot of experience of sharing quantitative data, and that is now almost an industry in itself. I think it provides a stepping stone to a discussion about sharing qualitative research. So again, that overarching idea that they had more experience with quantitative data. And I guess to me what it means is researchers collecting data and then storing it and having consent from the participants that they can share the data with individuals outside of the research team for future research. So this was the understanding that participants had of data sharing in qualitative research and trials. Next slide, please, Megan. But due to this lack of experience, there was a lot of uncertainties around this as well. So, you know, while being able to see the value of it, they didn't know how to do it or where to share the data. And they wanted more discussion on this. So again, recognizing the value of it, recognizing that it would help to answer different questions, and this potential benefit of reducing research waste. And again, particularly the benefiting of the research participants who had given their time and their thoughts. And as any of you who've done qualitative research, you know, that sensitivity, that emotion involved, let's make the most of it, they said, and let's give that kind of, you know, we have that onus or that moral obligation to make the most of that data. So again, the quotes. So I always walk away from a data set thinking, oh, there's so much more there that I'm not making, you know, not valuing what they have given me enough. But in the end, you have to go where you're next going. And again, just wanting to do something out of a duty, not a duty of care, but, you know, out of wanting to do something for people who have contributed their time and energy into collecting that data and contributing to that data too. So I genuinely felt, and it was very important for me, you know, to acknowledge my own potential biases here and not to, you know, to kind of park that when I was conducting the interviews and the focus groups. But there was a genuine person-centered focus in these responses, you know, that idea of, again, looking after the participants and making sure that their voices were used to a maximum really more than anything. Next slide, please, Megan. And again, with that sense of responsibility and that sense of moral obligation towards participants, this led also to a number of concerns around how to share qualitative data and whether it should be shared. And also this concern came from a lot of uncertainty around the guidance of how to do it and the ethical implications of it as well. Added on top of this, because our research was focused from a trial perspective, there's a lot of additional complexities around consent processes and things like that that added to the mix around this concern and uncertainty. Wanting to know more about controlled access, wanting to know more about data protection, and also just wondering whether it would be feasible at all. The consent process, acknowledging that there needs to be a rigorous consent process required for data sharing in trials, and yet there's already, as I said, quite a complex consent process already in trials. So how can you overburden patients or participants further by adding this extra layer of we will share data if and when and how? But again, that concept of informed consent was highly important as well. So here are some example quotes. In one of our trials, we had huge difficulties getting through ethics for one of the qualitative elements of it, which was with people who had refused to be randomized. And the prospect of actually adding in layers onto our consent when getting ethics in the first place was so complex. The trial was almost easy. It was all of the other bits that the ethics committee was really struggling with. I think that's a challenge. And another one, how do we as researchers know what data people have and how we can access it, and what the processes are to access that? Because you can't necessarily go on some university website and say, fine, I want to access your data, the qualitative data from your trials. I would have no idea how to go about that. And so that's kind of the other flip side as well. It's not just about us as researchers sharing our data, but if we also want to receive shared data, how do we go about that? Again, a lot of uncertainty around that. Next slide, please, Megan. And I'll just have a look. This one really, this was a big one for me as well in terms of pseudonymization and lack of context, and the kind of, you know, the conflict between those two, and how much, I suppose, the importance of pseudonymization, as Megan said, not just the participants themselves, but the settings they're in, and how could you potentially identify a specific trial site or a specific health institute based on the information. So that important process of pseudonymization, but then can you over pseudonymize to such a degree that you lose context? And, you know, how would secondary researchers view, analyze, interpret the data without those kind of nuances that you sometimes get from that contextual data that you would have to remove in order to share? I'll just see if I've reflected that enough. Yeah, so concerns that study participants may be worried if they could be potentially identifiable from transcripts, and may not be as open if they knew their transcript would be shared. So this referred as well to a concern around the quality of the interview. If you were going to be consenting for data sharing, would that inhibit the participants somehow if they thought that, okay, I'm safe enough talking to you and I'm happy enough for you to use my data, if this is going to be shared elsewhere, am I going to be as comfortable? And that primarily came from the qualitative researchers as well, who had, and I think it's on the next slide, you know, there was this issue around intimacy of interviews and how, whether, you know, and again, it remains to be seen whether sharing of qualitative data could threaten that intimacy and threaten that sense of safety. Yeah, so again, just highlighting the importance of context and whether that may be lost through pseudonymization. Your worries might be that if people knew the entire transcript is going to be out there, then that might make them behave differently. The whole point of qualitative is that it's meaning in context. You want to lose the context if that's what the researcher brings to it. I think if the transcripts are there independently, it could even in some cases be quite hard. You know, how much of it would you need to cut out? So again, those quotes kind of relate to what I was saying about the losing of context, and also the threat to the intimacy of the interview itself and the role of the researcher in that process. Thanks, Megan. Next slide. Further concerns, how time consuming it was going to be. Again, those additional layers to the consent process. You know, the importance of research participants knowing all the aspects of their informed consent and making sure that they knew what they were actually consenting to. Again, the concerns around that ethical data practices. And as I mentioned earlier, the kind of, I suppose, advocacy role of qualitative researchers, the fact that they're quite protective of their participants and the data that has been generated, and what would happen to that, or how would that be threatened by this data sharing process. And that's just a summary of those challenges. Again, referring to the ethics, the governance, the pseudonymization, and the lack of context. Excuse me. Whereas we go back to governance, and they were much more of the mindset, like we need to make sure this is completely anonymized if you're going to be sharing it outside. And that's just reminds me that many times our participants, or our, not the trial participants, but our participants refer to anonymization rather than pseudonymization, but we, you know, prefer the term pseudonymization. I'm just going to mute while I cough, and Megan could please move to the next slide. So our final theme, and apologies, I was sick yesterday, and our final theme was kind of what can we do to support people in this endeavour to embrace qualitative data sharing, you know, recognising its potential benefits, but also being aware of those concerns and those challenges. And all of our participants had concerns over lack of guidance, but also the funding, so the time and the effort involved in pseudonymizing and going through the transcripts, and making sure that they're non-recognizable, that requires time and money. also concerned around those absence of clear standards and established guidelines, about where, when, and how. Again, we talk about restricted access repositories, but there's more to it than that, and people just need to know where to go. They need to know how to do it. They need guidance on how to pseudonymize, the level of pseudonymization. Again, that kind of protection of the participants versus lack of or losing context. And they wanted clear and practical examples. And I think one of the things potentially that may come out of this work in the future, this is only a small scale study, obviously, but it will prompt further work, is around practical examples of qualitative data sharing to include sample consent forms and participant information leaflets, just the kind of go-to repository where people can say, okay, I want to include data sharing. This is, the terminology that I need to include in my consent forms and PILs. And they recognize that maybe it's already out there, and there is guidance, some guidance out there, but people lack awareness of where it is or where to go to get that. And again, going to the beginning, thinking about data sharing when planning the study design. And I see that myself in terms of even publishing protocols now, where they ask for all the data to be shared on Open Science Framework or somewhere similar. We said, well, we didn't get consent for that at the time, so it needs to be at the forefront of our minds from the very outset of planning our studies. So again, some quotes. I think the difficulty I found as well is where there wasn't a clear sort of guidance on exactly how to do this, or best practice maybe. I found that going to governance, they are very much of the side, very strict of what we need to share. And again, that kind of sings to my own personal experience, where there are rules, you're looking at fair data use, etc. But there are particular nuances here that need to be considered. And in terms of the consent form, I think the wording that goes into the consent form, what words people have used in the past, and just simple good examples that people have. So even at that very basic level, having those best practice guidelines, those practical examples for researchers to use would be really helpful. Next slide, please, Megan. Again, going back to the need for funding, recognizing the time-consuming nature of pseudonymization, the resources needed, and looking at infrastructures, cost, time, and that need for easily accessible guidance and resources. So I think we need the infrastructure to anonymize the data, funds around that. I think we have to start costing for the funds, but also storage facilities, repositories, data management guidance about how we index it, and make this available and file all the data so other people can come in and use it appropriately, which I think is a very important point. So it's like we need that infrastructure and funding, as well as just being willing to share the data, because without that, you can't really do it, to be honest. Next slide, please. So that's, overarching what our participants felt and what they felt was needed in order to look at data sharing of qualitative data in trials. And as Megan mentioned, we had a second work package, which is still currently ongoing, which is the content analysis of current consent procedures for data collected as part of the conduct of clinical trials. So we looked at consent forms, and we're still looking at consent forms and participant information leaflets. And again, we did a recruitment drive for this with the support of Sandra and the TMRN, circulating these flyers, and we retrieved, is that on the next slide? Because I can't remember the number, Megan. I think it's 21 participant information leaflets and 21 consent forms. So what we've done is developed a data extraction form. Again, Megan developed this based on what we know already and the guidance available. And we looked at, specific reference to how the participants' data would be used, and analyze firstly whether it was going to be shared, but also how they were going to consent for it to being shared. Now, as I said, this is ongoing. What we're seeing, or the patterns that are evident so far, is that there are, not all, but there are some instances where data is being, where participants are being asked whether they consent to their data being shared, but a lot of it is around reasonable request. There's a lack of detail of the specifics of where this data will be stored and how it will be shared. So people are consenting to qualitative data sharing, their interview data being shared at a reasonable request. So I think there needs to be you know, there is something in that and some work to be done around that, but also very little about how or why the data is being reused. So people are saying, we're going to collect your data, we're going to, you know, talking about data retention, talking about, you know, publications, using direct quotes, when the data will be, you know, destroyed. We may decide to reuse your data at reasonable request, but very little, or if anything, around why this would be valuable. So I don't think there's any kind of sales pitch here for the participants. And I think, again, that's something for further exploration. How will participants feel if they know why and how their data is going to be shared, and recognizing the difference between, you know, statistical data, quantitative data, and sharing their thoughts and feelings, and as I said, ultimately that intimate conversation with a researcher. So that's just showing you what the content analysis looks like at the moment. It's quite tabular, but we'll also be kind of adding a more qualitative element to that in the write-up. We're just trying to get an overall picture here at the moment. And just to end with the dissemination, so we'll be presenting to the TMRP trial conduct and health informatic working groups. Use these findings, as I said, it's a relatively small piece of work, but it's going to inform further grant applications. And hopefully, I mean, the big prize would be if we could come up with some cohesive best practice guidelines. And then further dissemination through social media and through the websites that we list there. So what are the implications? We'll have this insight into existing practice. So we'll know what's happening already. What are the, you know, benefits? What are the opportunities? But also what are the existing issues and challenges, as I think hopefully I've managed to articulate by presenting the findings, helping to shape future research, helping to develop this guidance, and you know, building a community who are interested in this, and building a community who recognize that there is no one size fit all for qualitative data sharing, and that best practice guidelines need to be flexible yet informative, structured yet open to question as well. And I know that sounds like the holy grail of qualitative data sharing, but having that kind of, you know, almost a logarithm of how and the steps in which you take at which point, also depending on the data that you have and the participants that you have. And something has just come to mind that didn't appear in the slides was around very specific populations, so rare diseases, or, you know, people where there populations that are undergoing or engaging in clinical research that might be more easily identifiable. So, you know, having those different pockets of change and nuance and flexibility depending on the nature of the data and also the nature of the participants. And our big thank yous to our funders and Sandra Galvin and the rest of the team, including Elaine, who we have here, and the participants who were so forthcoming sorry, there's a dog barking, so forthcoming in giving their time and their insights as well. And just interestingly, I suppose just to end on this fact, because we've been talking about sharing qualitative data, because this for us was an exploratory study, we actually didn't ask or consent, or didn't ask our participants to consent to sharing and reusing their data. We felt that we wanted to have a more considered understanding of the lay of the land before we did that, which did kind of trip us up on the protocols. I think that's it. Thank you for managing the slides, Megan. I appreciate I didn't have control, so I had to be a bit bossy, but thank you.
No worries at all. We hand it over to Elaine maybe now.
Thanks so much, guys. That was really brilliant. And then I always get so excited with this stuff because it's, you know, it is quite new. And as you're saying, there's a lot of uncertainty and lack of knowledge. So I think it just kind of starts getting your brain juices flowing in terms of next projects and future things. So it's really exciting. So, so we have time for questions. So if people want to either pop it into the chat, or you can stick your hand up and I'll come to you. But maybe while people are thinking of questions, I have loads of questions. Go
easy.
I suppose one of the things I was thinking of, Catherine, was you mentioned that one of the aims initially was to develop relationships with, say, like the bigger stakeholders like the HRA and the CRFs, the clinical research facilities, around qualitative data sharing and trials. I'm just wondering how is that progressing at the moment, or how has the whole project and stuff been received by them?
Yeah, so I guess I'll take this one, Megan, if that's okay. So we are a little bit behind time in terms of writing up the report. What we wanted to do was have our report ready and disseminated in order to kind of raise awareness about what our project was. And then we have plans in place, I suppose, with the TMRP trial conduct group and the health informatics group, as well as the TMRN and Quest, to kind of develop a group in itself who, almost like I'm trying to think of the word now, not a consultancy group, but I'm struggling to find the terminology, but a group who could work together in a priority setting group, almost, in a way that we could actually think about what needs to be done and how we can drive this forward, while simultaneously, as you say, looking for future funding or future projects that we can drive this. I definitely, as I said, it was an exploratory study, a scoping study. We really wanted to see how people were feeling about this before setting the next stage. So very much kind of a scoping exercise of how people are feeling right now.
Brilliant. Yeah, thanks. Because I think it's just, and even come from the studies we did before, that I suppose the broader institutional levels and having these kind of organizations on board at the start, I think it's really great. So well done. And I think building that into the study as an explicit aim is really great. So I think Olga Persky has a question. So Olga, I'll unmute you there if you want to ask yourself. And
thanks so much. Yes.
Start your video if you like as well.
Sure. Yes, I'll start my video as well. Hello. Yeah, so thank you so much. This is so interesting and valuable work. And sorry if I missed this, but I was just interested in kind of, so as part of participants kind of sharing their experiences, are you also kind of collating any existing examples of where people are currently doing this, kind of any published work where people have linked to data sets? Sorry if I missed this and this was already a big part of the work.
Well, I suppose firstly, the trialists and the qualitative researchers involved in our study shared their experiences as to whether or not they had been involved in this before, but I think you're only talking about one or two that had actually shared qualitative data or sought access to qualitative data. And in one of those, if I remember correctly, Megan, it was across study site teams rather than for new projects with new research aims. And there was one person who was using shared data, so conducting a secondary analysis, and actually had concerns themselves about asking new questions of that data. So again, we were all kind of in the same boat in terms of where we were coming from. There were no experts in qualitative data sharing. It was, as I said, this kind of exploratory thing. But then again, when we sought the documents for content analysis, we could see that it is ongoing, but those won't necessarily be linked to the participants that were included in our focus groups. I hope that answers your question, Olga. And again,
yeah, definitely. Yeah, thanks so much.
As Elaine said, it's the work that follows this, and again, that when I speak about a moral obligation to make the most of the data, we don't want this to be just a one-off study that gets published, if it gets published, but rather that it leads to further work, because that's where our responsibility lies. And again, through developing those collaborations and trying to make those best practice guidelines.
Yeah, no, thank you so much. And yeah, I think it just highlights kind of how novel this is, and that there's practically no examples of where people have done this already. That's just such an important point as well. But yeah, thank you so much.
Thanks a million, Olga. So just had a comment from Niamh Kwan, who just said she had shared some participant information sheets with us, and so looking forward to seeing the results of work package 2. So that's nice to see you here, Niamh.
And obviously, because of the way we do, I don't know which ones they are, so I don't know whether they refer to ones that included data sharing or not. But yeah, we look forward to kind of finishing that phase off as well.
I had another question, Catherine, I suppose, just about the participants in the interviews. So I kind of noted that there was predominantly qual researchers who took part, and then say 3 clinical trialists and 1 trial participant, like I presume some sort of patient person who was involved in a trial. And I'm just thinking, that's such important information, like you were saying about, the participants in the trial being okay to share their data and stuff. And just, I know the challenges with recruiting to interviews, especially during COVID times and everything's online. Just wondering, what are your thoughts on that in terms of, did you feel that there's, is there gaps still missing? Is there ways we could plug those gaps a bit more, or just ways to try and get those perspectives a bit more? What are your thoughts on that?
Yeah, so it was very disappointing that we only got 1 trial participant, because I was very interested in their perspectives, because again, when you're looking at qualitative researchers and again, this sense of advocacy and this need to protect our participants, are we speaking for them in a way as well? Would they change their minds, or would they interview differently if they knew it was being shared, or do they have those same concerns around pseudonymization? And it's almost like, are we doing them a disservice by having those concerns? So the voice and the thoughts of those trial participants was particularly important to me. So it was a disappointment that we couldn't recruit further. Again, because of the nature of our recruitment during COVID in an online world, you're already being exclusive because you're relying on social media platforms, you're relying on dissemination through emails and groups and things. So I'm very conscious of the lack of inclusivity that we've invariably faced throughout COVID, rather than, there was no chance for us to go over to the clinical research facility and talk and encourage people to take part in our interviews. And I think that would have made a difference, having, I suppose, based on my background of qualitative research, just seeing the researcher talk about what they want to do and why is often, that's 100 times better of a recruitment strategy than coming up with a fancy flyer. But we were very grateful to have the fancy flyer, because that's all we had to hand. But certainly in better times, that chance to reach out to trial participants would be very important to me personally, as well as to the evidence as well.
And perhaps lends itself to, like, doing this study in its same format again, a couple of years down the line, when maybe things have moved on a bit, and be interesting to then see what the changing perspectives might be.
And we must acknowledge that the trial participant that we had was very familiar with research as well. And I think, as best as we tried to present the language of qualitative research to the trial participants, it's quite a nuanced question. You're not asking a person, why did you take part in a trial or not? Or, it was an added layer that you would need to understand about the research process. And I'm not saying trial participants don't understand that, but there's so much going on. And as you know, my other work is around recruitment to trials and why people take part and why they don't. Asking them whether they want their interviews to be shared is, a whole other level as well. So we're asking a lot. Take part in a trial, then we're going to ask you questions about the trial, and then we're going to ask you questions about whether you liked us asking questions about the trial and then sharing it with other people. It's like, okay, I don't want to do any of this anymore.
The Russian doll of research.
Yeah.
So Thomas Loish, I'm sorry if I pronounced your surname incorrectly, so I'm going to ask you to unmute there, and if you want to ask your question.
Yeah, sure. I'm Thomas. That's fine. No problems. Thanks first of all for your talk and for the interesting insights. So I have to excuse myself because first of all, as you might hear, I'm from Germany, and so I'm not too well aware of the situation in UK and in Ireland. And second, I'm more of an educational psychologist than a health psychologist. But my interest in the topic is because I work in a team where we try to provide an infrastructure for educational scientists to share their qualitative data. And so I'm very curious how, in that project. And so my question would be how the situation in the UK actually is. So are there infrastructures that provide data sharing services? I would have guessed that like the UK data service might be available to share qualitative data, but I'm not sure about this at all. And maybe there are other providers.
So I'm not we are not as familiar with the UK situation either, being based in Ireland, but from what we were learning from the participants was that there were some infrastructures in place, but there wasn't enough knowledge and understanding as to how those infrastructures could support qualitative data sharing. There was, you know, everybody was very familiar with sharing of quantitative data and the structures that were in place to do that. But when it came to qualitative data sharing and the, you know, from the very start, the planning, the consenting, the repositories, the pseudonymization, people weren't sure where to go. And I would certainly echo that in the Irish context, based on the work I did with Elaine as well, that people, you know, it's not that they don't exist, it's that people aren't aware enough of them or where to go for them. So that would be.
Okay, and may I add something? Because then you already said in your talk something along the lines, maybe the information is out there, but not at the researchers. So is it maybe more like a transmission or a communication problem than a problem of creating the resources to provide guidance?
Yeah, so, and I think that came from the data as well. You know, people were saying, we don't have the guidance, but they were also saying, it could be there, it's just we don't know enough about it. But at the same time, in our own kind of preparatory work and our own scoping for the project, we found it difficult to find clear guidance also. So I'm not sure that I'm not sure the guidance available in its current state is fit for purpose either, as well as people not being able to know where to find it. So there's kind of a couple of layers going on there. And you know yourself, when people are busy, they want to be told where to go. They want to be told what to do. You know, they don't want to have to look too hard for it. They'll give up eventually. And I'm sorry if we spoke fast. Both myself and Megan have a tendency to talk, no disrespect, Megan, but we both talk quite quickly. So apologies for that, Thomas.
No worries, and thank you.
Thanks so much, Thomas. So are there any final questions? I have maybe one more question myself, but I want to give other people a chance to.
Here's somebody else ask a question.
Exactly. So has any other final questions that they wanted to ask or raise?
Okay, Elaine, you're allowed.
I suppose it's just a quick question just about kind of university level awareness and kind of working with ethics committees. Because I know before when we in the study mentioned that we did with early career researchers, and we kind of went, you know, too late to kind of suss out, you know, what could be done to share the qualitative data from our study. But it was very new to the people on the ethics committee themselves, and they couldn't really give much information either, I suppose. And I suppose I was just wondering, did that come up, or university level ethic type thing, did they come up in the
there was some discussion around the difference between governance and ethics committees, and it was the kind of discord, I suppose, between, you know, what the GDPR and the whole FAIR system and the whole emphasis on data sharing, and particularly, you know, from our funding, our primary funding body in Ireland, for those who are not familiar, is the Health Research Board. You know, and they're, you know, they talk about all of this stuff, but the ethics committees haven't really incorporated it into their thinking, and they haven't yet incorporated it into their, you know, even on the application forms, you know, it just hasn't, and so it is quite a top-down approach at its current stage. And I believe that for all data sharing, not just qualitative data sharing in Ireland, it's still quite top-down. The funders are, you know, talking about it. There's this huge awareness in terms of the open science community, mainly driven by you, Elaine. But at ethics committee level, it's still very new. And I think that came up, it was somebody in the UK who said that as well. It was that discord between the local ethics committees and then this higher governance structures.
Yeah, because it is really interesting. It's as you say, it's coming very much from funders and stuff, which is brilliant to see. But then the kind of maybe middleman between the funders and the actual researchers doing the stuff is maybe.
And maybe that goes back to Thomas's point. You know, it may all be out there. It's just, where do people find it, and how do people become raising awareness of it as well? So.
Brilliant. So so I suppose we might wrap up there, and just to say thanks so much to both Megan and Catherine for really, really fantastic interesting talk, giving us loads of ideas of stuff we can collaborate on and do going forwards. And just remind everyone again that the session has been recorded, including the Q&A, because I figure a lot of the really juicy and information, interesting stuff happens in the Q&A. So that will be put on YouTube, on the EHPS Open Science Special Interest Group YouTube channel afterwards, and we'll email all participants and attendees a link to that.
I think just as a final word, Elaine, I think what you've said, I don't know whether it's a sign of a good webinar or a failed webinar where you leave participants with more questions than answers.
No, it's always good, I think. Yeah, stimulating. Thanks so much, guys, and thanks to everyone for attending. Really appreciate it, especially after last week's technical hitches. So yeah, I hope you enjoyed it, and look out for more webinars coming up. Follow us on Twitter in the AHBS Open Science SIG Twitter page, and sign up to our mailing list, and just generally get in contact. So I'm always willing to hear from you. So thanks very much, guys. Bye. Have a great day.